Now to tonight's special report on the mother of all studies. It's the biggest of its kind ever conducted in Australia, charting the health of more than 50,000 women across generations. And the study is providing a wealth of information for researchers and policymakers. ABC reporter Donna explains.
For the tens of thousands of women recruited for the Australian Women's Health Study, it's a ritual, filling in a lengthy survey that looks at their health, lifestyle and relationships.
This is a gold mine.
It was started in the mid-90s by a group of researchers from the universities of Queensland and Newcastle.
To investigate this issue of whether the health service was appropriate for women.
The group recently celebrated the 20-year milestone.
It was way beyond anybody's imagination, I think, that it could actually keep going.
That to me really made me feel for the first time what an amazing thing here that we've produced.
Chances are any significant women's health finding in Australia originated in this study. The National Women's Health Policy is built around the data. Women were drawn from across the country, some entering old age, a middle-aged group and a young cohort of 18 to 23-year-olds. Back in 1996, that was me. I was a university student and joined the study in the interests of research. Much like the project's founders, little did I know 20 years on, I'd still be filling in my surveys, documenting major life events and health highs and lows. A new young cohort was recruited in the past few years, and their results are cause for concern. Back in 1996, 1 in 5 18 to 23-year-olds reported symptoms of psychological distress. That figure's jumped to 1 in 2. And while young women now exercise more, on average they're 4.5 kilograms heavier.
The health of the new young cohort is something that we need to monitor because obviously they're heavier at such an early age and that implication on their health and well-being.
More than 700 researchers worldwide are using the data and 660 projects have relied on the information to look at everything from reproductive health to domestic violence, obesity, breastfeeding and predeterminates for serious illness.
Government policy in health needs to be based on data, and if we don't know what's happening in women's lives or if there are any emerging health problems, we can't plan services to meet those needs.
Professor Wendy Brown was a founding researcher and now uses the data in her work on physical activity.
So if you are or are not active, are you more likely to develop cardiovascular disease, cancer, dementia?
The study now charts the health of 58,000 women and there are no plans to stop. In fact, the next phase will involve the children from my group, all 16,000 of them.
We're hoping to see how the health of the children affects our cohort members, which are their mothers, and also the health of the cohort members and how that affects the health of the children.
Coming full circle. Donna, ABC News.